University of Sussex. I'm trained both in anthropology and sociology. And I'll be presenting some of my work that I'm doing on NTDs, and more particularly on tobacco control, which is one of the key risk factors for NTD. Let me first give you maybe an overview about NTDs, especially in the global south. That's where we're interested. For a long time, people have thought NTDs, and by NTDs maybe I should explain that's non-communicable diseases, it's cardiovascular diseases, it's cancer, diabetes, and so on. For a long time, people thought that's a disease for developed countries, for the US and Northern Europe, Australia. And this idea has kept, was with us very much until the late 1980s, early 1990s, where studies becomes challenged. Today, it's clear that actually NTDs is not the problem of developed countries, but mostly of developing countries, or low and middle income countries. And let me give you some numbers, like there's, I think, 57 million deaths due to NTDs per year in the world, and 36 million of those are in developing countries, so that's 63%. I'm sorry, there's 57 million deaths, and out of those, 36 million are due to NTDs. So mortality, the global burden of disease worldwide, NTDs is clearly prevalent. And of this burden of disease due to NTDs, 80% is in developing countries. So it's really marked. And that's for every continent. In every continent, basically, NTDs are the #1 killer. Apart from Africa, but the WHO says literally within 15 years, in Africa as well, NTDs will be the biggest cause of mortality. This has generated action, high-level international action. There's like a lot of lobby groups, like the NTD Alliance, bringing in different groups around the world, trying to lobby countries to do something about that, and try to intervene in developing countries. Recently, the UN had a UN summit on NTDs where they wanted to pledge action. They want to try to integrate NTDs in the Millennium Development Goals, the new ones, when they will be renegotiated in 2015. You know, there's been also action of the WHO, the World Health Assembly, where they just agreed targets a few months ago about how you could reduce NTDs in developing countries. And the thing with developing countries, there's this idea of a double burden. It's not that they don't have infectious diseases anymore. They do. We heard that all along today. But that on top of that, they are having now also NTD. And why? It's because, you know, there's urbanization. The populations are aging also in developing countries. And there's also a lot of unhealthy lifestyles, as it's called, being brought in, especially by transnational corporations. You know, think about food, fatty food coming in. Think about cigarettes coming in, and so on. So NTD has become, to use again this crisis model that Stefan was talking about, the new crisis, the new epidemic coming up. I think there's interesting questions to be asked as a sociologist or anthropologist in relation to that phenomenon. The two I have is like first, try to take a step back and try to understand how is that become possible for NTDs to become this global health problem. And the second is how do you try to export the knowledge about NTDs, those strategies that you develop to prevent NTDs in developed countries, to developing countries? I think that's the two questions. And to do that, I'm looking especially at tobacco control. And why am I doing that? Because well, it's one of the major risk factors for NTDs. It kills up to 5 million people a year. And as tobacco control activists love to say, it kills more than AIDS, malaria, and TB altogether. So, you know, they always like to use those numbers to make their case. But so that's one thing, and I think tobacco control is also interesting because unlike other NTDs or risks for NTDs, there has been a lot of action. There's a framework convention, worldwide convention, that was signed in 2003. and it came in force in 2005. And there's also now a lot of money being poured in through the Bloomberg initiative. Bloomberg is the mayor of New York, yeah, and Gates. So I think they put in $750 million in an initiative starting in 2005. So I think that makes it interesting as an interesting case studies for other entities. So the first question is about how did this become a problem? How did tobacco control become a problem? Three things. I'm running out of time completely. I think the three things I want to highlight are two things. The making of a global tobacco control movement from the 1950s onwards. You needed a lot of people to come together, doctors, activists, and that has taken over 50 years. I mean, we don't realize that there's a whole history, and that's the first thing. The generation of epidemiological knowledge. For a long time, there was no figures. You could not say there's an epidemic without presenting numbers. There was anecdotes, doctors knowing that they had to treat a lot of people because of cancer, lung cancers in Africa and stuff like that, but very, very little figures that you could present to. And there was also the generation of strategies, like especially their economists being very, very important. And I mean, we can come back on that. I realize I don't have time, so I'll have to. There's also a question about how you export this knowledge that you created in developing countries like the US, Australia, and Europe. How do you export that to other countries? How you export new types of advocacy to different countries, how you export different types of knowledge, and all the problems of translation. You know, people are not interested in risks about smoking. Think about the sex workers before. I mean, try to tell them that when they're 50 or 60 they might have cancer. They're not interested. So those kind of things, and the lack of funding and so on. So that's really the second type of question and that you can be interested in. Yeah. So that's basically all from